The interest of doing this module for you, uh, this is the interest is that first of all, the most important module of anatomy, human anatomy, from our curriculum. Curriculum, we have 3 modules of anatomy, human anatomy, 1, 2, 3. Which you have completed, I hope successfully, although and this module is less complex than this module of human anatomy 2, and the module of human anatomy 2 is the most important module in human anatomy modules. So take advantage of having it and learn hard, because it's needed for all medical practitioners, because it gives a basis of think all medical doctors dental are doing every day. The first is the vital sign. Vital sign, like respiratory rate, which is related to this course, the lung being the vital organ of the respiration, which we are going to see with the thorax. You have the pulse, which is related to the heart rate, right? That you can also auscultate directly on the heart. At the apex of the heart, you can auscultate and have the heart rate direct from the heart without taking the pulse. And the BP, you have the BP, which have two rate. The one is a systolic, which generally gives the importance of the power of the heart, how the heart is pumping the blood, and we have the diastolic, which indicate the resistance of the peripheral blood vessels. This also, the basis of it will be understood during this course. You have a vital organ within the heart. Generally, for example, if you are in coma, it means that your brain is not well functioning. You can survive. You can survive, maybe again recover. There are people who have beat the record of being in coma for a long time. And when they are in coma, they have what is called vegetative life. Vegetative life, it means that they can, the heart is beating, they can respirate, breathe, they can breathe. Although they cannot eat by themselves, but if you give an alimentation, a diet through a sound, nasogastric tube, they can digest. They can digest the diet you are giving through a tube. They can urinate, means that they are producing urine. They will produce the feces, and the only thing they cannot do is to interact with the environment by the sensation motor activity, etc. So, if the heart is not beating, you have a cardiac arrest, you are going to die. If you are not breathing, means that you have an arrest of respiration, you are going to die as well. So these are vital organs that are needed for the life to continue. So it's important that you understand the anatomy of those vital organs, and then you can also understand the disease of the heart. For example, if you have the coronary artery, which is obstructed or stenosis, you are going to have a reduced flow in the coronary artery and branches, which can end up by a stroke, which is and then ischemic infarction of the heart, the myocardium. And this can be survived, and then we are going to have at the heart a scar. But if it's a massive infarction, then it will end up by a death. The lung is the same. The lung is the same. For example, if you have a trauma, and you have a chest trauma, and you have, for example, expensive or tension pneumothorax. If you don't receive rapid care, you may die. And you are going to see that with the thorax. It's simple. If someone have a tensive pneumothorax, what you need to do is just to put a needle at the second space. The second space that you are going to know exactly how to identify it by knowing the sternal angle of Lewis, which will indicate you where is the second intercostal space at the middle clavicular line. Then you put a needle there. Then you are going to evacuate the air, which constitutes the pneumothorax, and save the life of people. So by just understanding this anatomy, you can save life of people. Although knowing that the heart is a vital organ, someone who have a cardiac arrest will be secure by someone who is near to him. So this is why, for example, everyone, not only medical and health professional, everyone should have at least essential skills of resuscitation by massage, external massage of heart, which is a simple gest. You stimulated the heart to restart the beating by doing a massage at the heart externally. So this is an important, and I know that you are probably in your association as a student. You can also teach the population how to do that, saving life skills. So this course, although all medical practitioner, dental practitioner need this anatomy to understand the basis and then apply it to the clinic, it's very important in a different domain or field of specialization. In internal medicine, it will be essential for gastroenterologists, cardiologists, being a pediatric cardiologist or adult cardiologist, pneumologist, and nephrologist. Now, we have at our school MED program. MED program, it's Master of Medicine in internal medicine. Then they finish as a physician, internist, and then they can do additional 2 years to be gastroenterologist. Fellowship is an offer here at the School of Medicine. The same as adult cardiologist, pediatric cardiologist, the program is offered. And you know that there are a project of having a heart hospital in Masaka. So those who are interested to become cardiologists, they have the job which will be ready for them, and good equipment infrastructure which is built on here in Rwanda. Pneumologists do with the respiratory system, and we have also a program which have started. Currently there are just 2 pneumologists, fellow, who have the degree, and then the program also is available for you when you are going to be ready to take that. The same like a nephrologist. The program also have started. So in surgery, almost all the surgery, but more importantly, general surgery. General surgery, which deal mostly with the abdomen, which is an important region. And the apart of general surgeon who are very linked with this course, you have the thoracic surgeon. General surgery is a program which is available here in Rwanda at our school, and we have a resident in that program. Thoracic surgery is not yet offered, but we are the program of cardiothoracic surgery have been accepted by the college to begin, and I know that there are 2 people who are outside in the training, and the program will be offered with the next academic year. So if you are interested to become a thoracic and cardiac surgeon, to take that course. But it's essential that if you have the ambition to become that you work hard during this module, so that you have a good foundation to take those programs. Urology is a program which is offered here, 5-year program, and you can pick the interest and then work hard to have the basis of that specialty at your stage. Then we have vascular surgery. Vascular surgery, now there are 5 pupil surgeons, Rwandan surgeons who are in the training, or who are on the way to go for the training. Generally, it's a 2-year program for general surgeon. Those who have finished general surgeon, then they take a fellowship in vascular surgery and deal with very challenging condition of vascular disease. And now, someone who has a vascular disease will go outside Rwanda to have the treatment. Plastic surgery and reconstructive surgery is a program which is here, offered here in Rwanda, and they are resident in that program. And Prof. Austin, who is the chair of the surgery, is a plastic surgeon and then responsible of that training. Transplantation, there are a fellowship which have begun. Transplantation. Transplantation surgery is not something which is difficult, but the surrounding environment is the most challenging that one should have to have the service ready. Obstetric and gynecology, this is a domain which is very interesting, and now there are a subspecialty within that, endocrine and fertility or gynecology. We have fetal medicine, and there are oncology, oncological gynecology, which are coming to develop that domain. So you see that you have, with this course, you are going to have a foundation for your ambition if you have ambition to grow further. But there are no any choice at your generation, because previous generation, you are a general medical doctor and you practice everything almost, but now you need to go further, specialization and subspecialty, to be able to work in the competitive health system, healthcare system. So let me move on the next slide. So the learning strategy is that you have TBR. You are familiar with it, isn't? Isn't Sepe? Yes, I see that you are reacting. Then we have blended learning. This is online combined with physical, online teaching and physical. Then you have the opportunity to have WhatsApp forum discussion. Although I have not been asked to be with you, but if you have some burning topic you want that to exchange with the anatomy team, you can time by time put us on your WhatsApp group and ask a question on a specific theme, and we are going to be happy to support you. So up to you to identify challenging topic, or if you want to have a clinical correlation with a specific topic, you can create a forum for 1 or 2 hours, and then you invite us, people in anatomy, and we are going to be happy to support you. So we have a practical teaching, which is important. We have cadaveric anatomy with different specimens, and you are now familiar with that. And we have the anatomy. Probably in the future, we may have also ultrasound machine that may be used to the practical teaching of the anatomy. So it's important that you have a self-directed learning strategy. So it's you to direct the learning, not the teacher, not the we instructor we are supporting. But you need also to create a spirit, a team spirit within your teams, different teams, but also to interact with your colleague, your classmate. If you know that someone is more brilliant than you, why don't you sit with him and then have a discussion with him? I'm very happy that a student, you student, with your organization, METSA, you are doing this pair learning session. So I encourage you to continue doing that. Okay. So there are a very interesting statement that I made, that students need to interact with learning material and pair rather than seeing the face of instructor. Do you agree with that statement? But this is the most important, because no one will learn at your place. What we can do is to push you by assessment, by providing good environment. But at the end, it's you who are the learner, and you need to interact with the material and as later as possible, and interact with your peer, so that you sometimes the student explain better than a teacher, because probably he speaks the same language with his peer, where the teacher may speak as an expert, and the language which is not well understood by the student. So it's important that we are here for sure. We are going to deliver the anatomy modules. This is our responsibility, and we have been doing that for long, and we are used on that. So, but it's important that you read the learning process yourself. The last
Oui. ntabwo nibura ubu mfite online class ndi kuri
you teach and you, before I reach that, this is the resources that you are going to use. The more that you have all, it's in the library, but I think that we have provided for long the soft copy, and I'm sure that you have it. It's important that you read more than you need to see other information more than what is provided by the PowerPoint notes. We have practical guidelines. We have also atlases, the net it's up to them. There are the Rohan Atlas of Anatomy, which is a very wonderful atlas which shows the real anatomy. But you have the anatomy lab resources, which are are available for you. You have the specimen, you have the radio anatomy, small lab, the medical, and you can use it as often as you want. No one that he don't have access to YouTube may not know things that he's all day with internal organ you are not going to see, but you have them. So we have provided for long the dissection video that I'm sure you have, and I recommend you the Auckland video because for me they are the best. You have also other resources. Generally, sometimes you may not have good quality resources. So, if you discover resources you want to use, please discuss it, share it with us in anatomy. First, the MODI reader, and seek his advice on whether these resources are good for you. So, the last is for me the most important, the last slide, because this last slide is our agreement. We are going to teach you, but you should undergo assessment for us to know if you have passed the module. So it's the same like the module 1. So you know that you have a continuous assessment that I call it the full period marks. So it's in course, which is half of the final mark, 50%, which include different. You have TBR generated marks, 5%. You have practical competence assessment, which include 2. In practical assessment, the small assessment that they will be giving you while you are doing the practical, you are in a practical session. And then at the end, the OSPA, which you have completed last time. Isn't? You did it on Thursday, isn't? So we intend to make it fair for you, and then we have the 3 cut on thorax, on abdomen, and pelvis and perineum. And then you have the final exam. So for every test, the written test at least, we have a question on the structure identification, either on anatomy image or medical image. We have general questions, general knowledge, and then we have a clinical structured question. So the importance that will be communicated by you to you by the MODI reader. So this is what I wanted to share with you. And so this is our contract, our agreement. This is how we are going to assess. And for any thing which will be not following this, please let us know, and so that we can adjust. So thank you for your attention. If there are any questions, I will be happy to answer it. Sepe, any question?
There is no question. Everything is understandable.
Okay.
Yeah.
So I wish you to have a nice experience, learning experience with us in anatomy, and I will be happy if before I retire, if I have a lady in the anatomy, because we are too many male in anatomy. So I will happy to have a lady in anatomy. So you are welcome in anatomy, ladies. I'm not saying that boys are not welcome, but we need also to have a female in anatomy to show that it's a domain which can attract people. Okay? Have a nice evening.
Thank you.
Thank you.